COVID-19 World Update and Current Restrictions. According to the most recent data from the Centers for Disease Control and Prevention, a new strain of Omicron has spread across the country. The Omicron subvariant XBB 1.5 has expressed concern about the potential for a second wave of COVID cases following the busy holiday travel season. According to the CDC, the XBB 1.5 strain is currently in charge of 40% of all confirmed COVID cases in the country, up from 20% just 1 week ago. The Northeast is reported to have 75% of confirmed cases of XBB 1.5. Although its origins are still a mystery, this Omicron strain appears to be rapidly dispersing. There is no proof that it causes more severe illness than any other Omicron virus, according to Dr. Barbara Mahon, director of the CDC's Coronavirus and Other Respiratory Viruses Division, who spoke to NBC News. While the number of COVID hospitalizations nationwide is rising, Mahon claimed that areas like the Northeast, which have experienced high levels of the new variety, have not experienced an excessive increase in hospitalizations. Hospitalizations have typically been rising across the country, she stated. They don't appear to be raising their scores where there is more XBB 1.5. According to an NBC News count, the 7-day average of daily COVID admissions reached 42,140, an increase of 4.2% from 2 weeks prior. Additionally, the 7-day average of daily admissions to intensive care units has increased to 5,125, up more than 9% from 2 weeks earlier. Mahon said there are still many unanswered questions regarding the most recent subvariant, including whether it is more communicable than other varieties of Omicron. Others believe that XBB 1.5 is even more adept at evading the defenses that COVID immunizations and prior infections with the several Omicron strains that have proliferated since last December, including the original BA1 and the more recent BQ1.1 and BQ1 subvariants, have helped us develop. The Omicron XBB variant, which is a recombinant of the Omicron BA2.10.1 and BA2.75 subvariants, is related to the XBB 1.5. In the United States, XBB and XBB 1.5 account for 44% of instances, outnumbering other Omicron variants. The World Health Organization reports that XBB has been found in at least 70 countries and has been connected to virus outbreaks that occurred in October in several Asian countries, including India and Singapore. A person exposed to the virus would be more likely to become ill, become reinfected, and exhibit symptoms, according to laboratory studies that have shown XBB can evade antibodies from prior COVID infections or immunizations. Dr. Isaac Bogach, an epidemiologist and physician specializing in infectious diseases at the University of Toronto, stated that it is obvious that XBB has immune-evasive qualities. That has been shown in both lab experiments and clinically through instances and hospitalizations. The story is not entirely told by antibody tests. Evidence suggests that other immune system components can defend against the virus and that the COVID vaccinations should continue to help prevent serious illness and viral death. Do COVID vaccines work against XBB 1.5? One of the encouraging signs mentioned by Rick Bright, an American immunologist and former director of BARDA, is the success Singapore has had with XBB. There is an increase in instances, but Bright said that we didn't see the associated substantial increases in hospitalizations and deaths. The speaker said, "We believe it's because more individuals in Singapore get the most recent immunizations and boosters. Unfortunately, there may be a problem with that in the US. The coronavirus can take many different forms, but people 65 and older are most susceptible to it. However, the most recent CDC data shows that just 37.5% of that age group has received the revised Omicron booster. To strengthen your immune system against the most recent subvariants, experts concur that getting a booster dose with the bivalent vaccines is the most crucial thing to do. The improved COVID vaccination is especially important for those over 65, a high-risk cohort that has previously shown relatively low booster uptake, according to Mahon, who noted, "We're not in 2020, but people still need to take this seriously and protect themselves." The new COVID boosters from Moderna and Pfizer-BioNTech improved antibody responses to various subvariants of Omicron, including the XBB variant, according to a study published last week in the New England Journal of Medicine. According to Mehul Suthar, an associate professor at the Emory Vaccine Center at Emory University and the report's author, the new booster known as a bivalent because it targets the original coronavirus as well as the Omicron strains BA4 and BA5, offers more protection than the original or monovalent boosters that were previously accessible. When utilizing monovalent boosters, your neutralizing antibodies just aren't as effective against the variants, but the bivalent booster dramatically improves things, he said. It's not ideal, but it has gotten better, so the bivalent boosters are working as they should. Zathar anticipates the new XBB 1.5 variant's immunological evasion capabilities will be comparable to those of XBB, even though it was not tested in the report. He anticipates that the bivalent booster will increase defense against the most recent form as well. In response to the unacceptable COVID regulations imposed on Chinese tourists, Beijing has threatened retaliation. The COVID-19 testing restrictions placed on travelers from China were denounced by the Chinese government, which also threatened to take action against any countries participating, including the United States and numerous European countries. At a daily briefing, Foreign Ministry spokesman Mao Ning said, "We feel that the entry restrictions established by some countries targeting China lack scientific basis, and some unreasonable acts are even more inappropriate. We bitterly reject attempts to utilize the COVID measures for political goals. We will take countermeasures based on the reciprocity principle." The comments were the country's sharpest on the matter to date. Australia and Canada have added their names to the growing list of countries requiring travelers from China to take a COVID-19 test before boarding their flight as the country fights a widespread coronavirus outbreak following abruptly losing restrictions that had been in place for the majority of the pandemic. In response to concerns regarding the scarcity of information regarding infections in China and the potential for new variations to emerge, other governments, including those of the United States, the United Kingdom, India, Japan, and several European nations, have proposed tighter COVID-19 restrictions on travelers from China. The French Prime Minister, Elisabeth Borne, sponsored the tests. Travelers from China to France will be randomly tested upon arrival and will need to present documentation of a recent viral test that was negative. "We are in our role. My administration is in its role, protecting the French," Borne said on the France Info radio station. The UK will compel Chinese travelers to take a COVID test before boarding the aircraft. Since Beijing isn't sharing coronavirus data, Transport Secretary Mark Harper claimed that the obligation is for gathering information. When travelers arrive in the UK, health officials will test a sample of them. Those who test positive won't need to be quarantined, he said. The Public Health Agency of Sweden said that it has encouraged the government to demand recent negative COVID-19 test results from visitors from China. The agency's announcement comes as Sweden, which has assumed the rotating EU presidency, has scheduled a meeting of the EU's crisis management mechanism in Brussels. At the meeting, travel restrictions were discussed to establish a consensus. The Swedish government is getting ready to impose travel limitations. Justice Minister Gunnar Stromer said in a statement, "We are conducting a dialogue with our European colleagues to get the same rules as practical in the EU." To apply strict controls designed to eradicate the virus, China utilized the zero-COVID strategy for the duration of the pandemic. However, this policy was significantly loosened in December. Foreign tourists will no longer be subject to quarantine upon arrival in China, according to Chinese authorities, allowing Chinese citizens to travel before January 8.